So regulation of body temperature, how the body continuously maintain constantly same temperature throughout the day. So this is the question, and not throughout the day, throughout the seasons, throughout the year. Okay. So because it is a wonderful uh, creation of the God, because if it doesn't maintain the temperature by the body, so whatever microorganisms are present in this universe will enter into our body easily. Understood? So that's the reason we have to stop. We have to stop those microorganisms by entering into the body. Okay, so the only one and only way, that is you have to maintain the temperature. Okay, because some microorganisms, why the body maintain 98, 96, 95, or between 96 to 97, 98, 96 to 98, or 97 to 98, or 98? Because most of the microorganisms which are present in this universe, they doesn't allow more less than 96 or 95. Okay, their tissue will burn, their cell membrane will damage if they have to enter into the body. Okay, so there's the reason our body maintain constantly 98, 96. Okay, so let's start how the body regulate the temperature. So basically in the brain, we have one important gland, that is hypothalamus, which maintain the temperature. And also the name of this gland is also thermostat. Okay. So it is maintaining the balancing throughout the year, throughout the day, throughout the weeks, throughout the month. Okay. Hypothalamus, but they are receiving the information from outside the environment and inside the body also. So because of those receiving information, they have to fluctuate the temperature within the body. Okay. So those temperature receivers where are present, they are present in our skin. They are present in the skin. What those are receivers? They are called receptors. So receptors always in the search of new things in the skin. Okay. They will search any changes externally happening. If external changes are detected by the receptors, they will give information to the hypothalamus. Hypothalamus. Okay. So that's like it will decide how to maintain the temperature. So first is to increase the heat loss. Means if the temperature is increased, so we have to lose those heat. Okay. Let's see. In warm environment or during exercise, the body temperature tends to rise and great heat loss is needed. This is accomplished by vasodilation in the dermis, increase in sweating. Okay. Basically, so whenever you are doing exercise, whenever you are running, jumping, anything you are doing, so the blood circulation increases to the skin level, dermis, epidermis. Okay, so what will happen? Vasodilution will happen, more amount of blood reach to the skin area, and we know that skin have glands, more is sweat glands activate, and it will release the heat with the help of sweat. Okay, this is how heat loss happen. This is the one thing. And mechanism to conserve heat, but we have to not to lose heat, but we have to store some heat also. How? During cold environment, we need heat. Who doesn't want to release the heat? So what will happen? Cell circulation is decreases to the sweat glands to upper area of the body. So whatever necessary organs, they will get large amount of circulation. But upper surface area doesn't require large amount of circulation. So the circulation to the sweat glands, other glands is decreases. So sweat will not come. Sweat heat is not lost with the help of sweat. So this is the things we have to remember. Next is fever. Fever, how this fever is happening, how we have the temperature. Let's see. It is very important because nowadays fever is most common. Okay, and now the seasonal fever, okay, is most common to the people, mostly children's. Childrens are suffering from large amount of diseases nowadays. I don't know how is happening, but would have to take the responsibility, okay, that childrens are more suffering. Number of diseases like cold, cough, fever, these are the most common. Okay, but we have to focus on their immunity. This is the thing we can do for to bring back their immunity to fight with the diseases. A fever is abnormally high body temperature and may accompany infectious diseases, extensive physical trauma, cancer, or damage to the CNS. The substances that may cause a fever are called pyrogens. Pyrogens include bacteria, foreign proteins, and chemicals released during inflammation. These inflammatory chemicals are called endogenous pyrogens. Endogenous means generated from within. It is believed that pyrogens chemically affect the hypothalamus and raise the setting of the hypothalamic thermostat. The hypothalamus will then stimulate responses by the body to raise body temperature to this higher setting. Let us use a specific example. A child who has a strep throat, the bacterial and endogenous pyrogens rest the hypothalamic thermostat upward to 102 Fahrenheit. At first, the body is colder, then the setting of the hypothalamus and the heat conservation protection mechanisms are activated. The child feels cold and begin to shiver eventually. Sufficient heat is produced to raise the body temperature to the hypothalamic setting to 102 Fahrenheit. At this time, the child will feel neither too warm nor too cold because the temperature what is the body hot. So basically here, uh, because of the pyrogens, our body temperature raises. So it will damage any body part. We doesn't know which part is less in immunity, which part is less working, which part is deficient, which part is decrease their function. So whenever any infection is came to the body, okay, so it will damage. So basically, the things which cause fever we will call pyrogens. Means and the main name is given is endogenous pyrogens. So basically, what will happen? They will end bacteria, anything will enter virus, enter into the body. So to the response to the bacteria, virus, our body produce inflammatory factors to kill the bacteria. So during that process, two things will happen. Either the virus or bacteria may be killed, first thing. Second thing, the power of the bacteria is more than our immune system, so it will spread throughout the body. Infection is spread from local area to other body parts. Okay. So in that process, it will also affect hypothalamus. Okay. In this also, it will affect the hypothalamus. So basically, hypothalamus is regulating temperature. So with that process, it may be the infection may be affect the hypothalamus to release more heat, first thing. Or second thing, it will advise to decrease the temperature. So in this process, two things will happen, but most common is the temperature is raised, okay, due to the infection. So here one example is given, sore throat. The sore throat is happen because the with the help of water, unhygiene food, okay, the bacteria in viruses enter into our mouth. Then it is, you have glands here. The glands are examined. They examine the food, the water which are entered through the mouth. Okay, so they found that there is bacteria, there is virus in that food. So they catch that. So what will happen during this process? They both fight each other. During this process, we will have sore throat. So it may be decrease or it may be increase. If our immune system is good, what will happen? It will decrease in 3 to 5 days. But it is not decrease, it will increase. So it will affect all, it will spread from that area to the all body parts. So what will happen? It will do two things. The infection will bring down the temperature. The infection will increase the temperature of the body. Okay, if the temperature is decreased, so what will happen? The hypothalamus again activated, and it will raise the hypothalamus. It will raise the temperature of the body to 100 or not 101, because the bodies get extremely cold. The patient has shivering, cold. Okay, everything he have. Okay, likewise, the hypothalamus is working. Next, what we have, let's study about that. So basically, this is the process of hypothalamus. You may be wondering if a fever serves as a useful purpose. For lower fever, they are the result of infection. The answer is yes. White blood cells increase their activity at moderately elevated temperature, and the metabolism of some pathogen is inhibited. Thus, a fever may be beneficial in that it may be shortening the duration of infection by accelerating the destruction of the pathogen. So basically, fever sometimes it is very good for us because it will damage the bacteria which enter into the body. Okay, the cell membrane of the bacteria will damage because the high temperature 102, 100, 102, 103, some persons have 104. So what will happen? The bacteria will die. Okay. High fevers, however, may have serious consequence. If fever increases the metabolic rate, which increase heat production, which in turn raise body temperature. This is a positive feedback mechanism that will continue until an external event act as a brake. When the body temperature rises above 106 Fahrenheit, the hypothalamus begins to lose its ability to regulate temperature. The proteins of cells, especially the enzymes, are also damaged by such high temperatures. Enzymes become denaturated, that is, lose their shape and do not catalyze the reactions necessary within the cell. As a result, the cell begins to die. This is most serious in the brain because neurons cannot be replaced, and cellular death is the cause of brain damage that may follow a prolonged high fever. So basically, the high temperature is also very dangerous because if the temperature is more than 106, maybe 104, 106, the temperature will damage the body cells, mostly enzymes, mostly brain cells, and mostly even hypothalamus is also not able to regulate the temperature. So it is very, very fatal, very dangerous 106 temperature. A medication such as aspirin is called antipyretic because it lowers the fever, probably by affecting the hypothalamic thermostat to help lower a high fever. The body may be cooled by sponging it with cool water. The excessive body heat will cause the external water to evaporate. This reducing temperature. Maybe a very high fever requires medical attention. So here Number of medications are there, like nowadays paracetamol is using by the doctors to maintain the temperature or decrease the temperature. Antipyretic we will call, and aspirin also given as antipyretic, but mostly paracetamol is used. And second thing is that sponging, wet sponging all the body is also necessary. Okay. During this process, the water in the body is evaporated. So you need water retention also. You need water. Okay, dehydration will happen. Okay, so it is very emergency condition. So you need medical attention. So basically, whatever important things are discussed here, we have to understand about the heat protection. Okay, how the heat maintained, how the heat losses, which gland is maintaining the temperature. So this is very, very important. So if anyone have doubt, you can ask.